everyone, my name is Ben Sockman, Specialty Clinic Manager here at Osceola Medical Center. I'm joined by Dr. Stephen Meisterling, Twin Cities Orthopedics, orthopedic surgeon. Thanks again for joining us.
Good to be here.
So there's a lot of patients who get to that point where it's finally time for joint replacement. There's a lot of anxiety sometimes, a lot of fear with that. Talk about when patients know that it's time for that joint replacement.
Sure. Joint replacement is the last stage of your joint care, and hopefully that's the last surgery you ever have. There is a limited lifespan for a joint replacement, so it's nice to wait as long as you can before you have your joint replacement, and so your joint replacement will last the rest of your life. It's not the best answer initially. You want to really go through these non-operative care means to improve your quality of life, manage your joint, and hopefully keep yourself happy. And at the end of the line, when all of these non-operative means no longer improve your quality of life, you're probably ready for a joint replacement. We spoke earlier about that. Those are things like medications, physical therapy, exercise, simple as ice. We do a lot of injections to maintain joints and maintain quality of life. And those things aren't working. You have pain, stiffness, poor function. That's when we start thinking about joint replacement. So typically, hopefully those patients are in their 60s, maybe their 70s. Sometimes you're in your 50s, that's a little bit young. And it can be a little bit younger than that, but it really has to be a very last resort. And there might be some, less than perfect, a joint that's less than perfect that you live with until it's time, so you can get to that age. And when it's time, it's time. So we do a joint replacement, and a typical joint replacement lasts maybe 15, maybe 20 years, it's hard to know. And so our life expectancy at 65 is about 20 years, and so that's why it kind of makes sense to have it done then.
And when we talk about sort of waiting for that time frame, and you talked about it quite a bit, listening to your body, so if you're younger and you're feeling that pain and you just feel it's time, would you recommend having that conversation with yourself or your partners to talk through, is this the right time or should I wait?
Yeah, you can start having that conversation at a younger age and before it's time, so you know what to expect and you know what opportunities you have short of surgery. For sure, the sooner you understand that if it's heading in that direction, I think the better off you are.
Yeah, with any decisions, weighing those risks and those benefits, and we've talked a lot about that. So Dr. Meisterling, appreciate your time. For all those, videos below in the comment section for past videos. Otherwise, have a wonderful day.